Hi there, everybody. It's Dr. Christine Anderson, also known as Dr. Chris to my patients. I'm in Los Angeles. I've been a chiropractor for over 30 years now, and my specialty is pediatrics and pregnancy. And I do also a lot of work with functional neurology and children with childhood developmental disorders. But it all comes back to the spine. And when we have good spinal health, then that means we can have optimal health. So if you're out there joining me tonight, just say hi. Let me know you're there. If you have questions, you can put them in the chat. I'll also put my contact information. So if you're watching this on the replay, you have a way of contacting me. So I am going to talk about the lumbar spine tonight, the low back, and I'm going to get to all of this, the chiropractor with her spine. But guess what? I get to tell you a little story first. So my story of my lower back issues. I had never had any lower back issues before, and I was in my senior year of college. I went to University of Vermont, and I was on my bicycle, and I had a friend that was in her car, and yeah, I was racing her in my bicycle, and she was in her car, and I hit a pothole, went over the handlebars, flat on my back, and I did a number on myself. I lacerated a kidney, I broke my collarbone, and I didn't know it at the time, but I also did some damage to my lower back. And at the time, I also was teaching aerobics, and I was very active. And one day, nothing really major happened. I didn't really do anything big, but my back went out. And that was the first time I ever experienced it. And at this point in my life, I had already decided I wanted to be a chiropractor, but I never had a chiropractic adjustment. I didn't really even know what chiropractic was about at that point. So I knew the philosophy, and I loved the philosophy, and that's what attracted me to chiropractic, and the fact that the body has a natural ability to heal itself, and chiropractic enhances that, and especially enhancing the communication with the brain, with the rest of the body through the nervous system. So there was a chiropractor up the street from where I was living, and I was like, well, I guess I'm going to go find out what this chiropractic stuff is about. So thankfully, I must have gone to a good one, because now I know not all chiropractors are created equally. And he was able to help me, and that was my first personal experience with lower back issues. And unfortunately, this became a sort of chronic thing, occasionally flaring up. And then after while I was pregnant with my children, and after I had them, I have 3 children, which places more stress on the body and the spine. Then it became a big issue until my last child, when my back completely went out on me about a month after his birth. And I was in serious, serious pain. It went out so bad, I could not even bear weight on my feet. My husband had to carry me into my chiropractor. Crazy. So it's been a long journey, and I always think, okay, my pain is your guys' benefit, because you're going to benefit from how I've been able to handle my own issues, because even though I'm a chiropractor, I'm not immune to these things. But I really had to dig deep and figure out what the heck was going on with me, so that I could create balance in my body that I wasn't getting, especially after that last pregnancy, because my back was going out on me every single year, at least once, maybe twice. And I am happy to say that pretty much for the past 7-8 years, something like that, knock on something, it is not. And so chiropractic is definitely part of my care, but I'm going to talk about some of the other things that I've incorporated as well so that you can benefit from this, so you do not have to live a life with chronic lower back pain, because it is a drag. But you would not be alone. So statistic-wise, about 31 million Americans experience low back pain at any given time. And worldwide, back pain is the single leading cause of disability, preventing many people from engaging in work, as well as their other activities that they do. And back pain is one of the most common reasons for missed work. And this accounts for about 264 million lost work days in 1 year. So this is super common, but it doesn't mean that it is normal. All right, we should not be having lower back pain. Experts estimate that up to 80% of the population will experience back pain at some time in their lives. And it's the third most common reason for visits to the doctor's office, behind skin disorders and osteoarthritis or joint disorders. So there you go. The musculoskeletal system, again, can be kind of like a pain in the back, right? So most people with lower back pain recover, but recurrence is really common, and that's what was happening with me. You'll hear people say, oh, once or twice a year, my back goes out, or it's something that happens all the time. But it doesn't have to be so. It really doesn't. As far as healthcare costs, it costs Americans at least $50 billion in healthcare costs. And if you add in those lost wages and decreased productivity, you can figure that number easily rises to more than $100 billion. All right, so how does this all happen, right? First of all, normal low back spinal development occurs in the first year of life when babies start to get on their hands and knees and crawl. That's when you go from a C-shaped spine to our traditional neck lordotic and lower back lordotic curve. So it goes into that sigmoidal curve. So if that doesn't happen, if babies aren't crawling, that may start them off where they actually have issues with their spine that can become problematic later on. Injuries. So like me, I had an injury, I had an accident. I don't even want to call it a sports injury, but sports injuries, car accidents, falls, slip and falls, you name it. Any type of injury to your spine can predispose it to having issues later on. I mentioned pregnancy as well, and there's some women that either they don't have any problems until they get pregnant when their ligaments get looser, or they may have lower back issues, and sometimes their low back issues resolve while they're pregnant because their muscles relax. So it's kind of a either or situation, but that lordotic curve of pregnancy increases, and that's going to put some stress on the lower back, the spine, the muscles. So this is a common thing during pregnancy. Lifting heavy items, especially improperly, you're going to strain your back. The worst is when you're bending forward and you're twisting. That's like the worst thing you can do. And think of what moms do all day as you're bending over the crib, trying to pick up your baby or put them down, and you're twisting and you're not really even thinking about how you're moving, and you're already in a vulnerable state because your body needs to kind of glue itself back together after pregnancy. Chronic poor posture. This is a huge one. And I really do recommend going back to my general posture show and listening to what I have to say about that, because that's going to affect everything relatively. Bottom up, top down, it doesn't matter. And then as far as exercising goes, you can be exercising, but are you over-exercising? Do you have proper form? Are you running on concrete? Is it a one-sided sport that's asymmetric like golf or baseball or tennis or even aerial arts? So thinking about that, and also with exercise or any activity, not warming up is a recipe for damaging yourself, because your muscles are going to be too tight and you have the possibility of straining a muscle or spraining your spine. All right. So along with that poor posture also comes your core. And we talk a lot about the core when we speak about the spine and posture. And what that means is that your muscles are balancing to kind of hold you like a girdle so that everything just isn't, right, just relaxed. And I will do a show in the very near future where I do talk about what proper core is and how you can get it. I did a post, an exercise on psoas, the hip flexors. So I'm going to put a link in the description so you can go find that, because these are the hip flexors are the muscles in the front of the spine. And if they are tight, they're going to pull right here on the front part of the lumbar spine. And when they pull on that, it's going to create stress and tension here. It's going to also increase that lordotic curve. So making sure that your hip flexors are stretched is important. And if you're sitting, you're going to need to do it. That's it, full stop. The other thing that can occur and really create some problems in the low back are trigger points in the muscles. So there's muscles on each side of the spine here, as well as connecting to the hips. And especially those ones connecting to the hips, there are major side benders, and they're called the quadratus lumborum. Those are often really, really tight when people have low back issues. And oftentimes there's something called a trigger point in them. And that's an area in the muscle. It's related to where that tissue derived embryonically, if you can believe that. But sometimes I'll press into it and actually refers the pain down to the butt. And that's an active trigger point. So if I'm just working on the spine and not dealing with the muscle issue, then it might not be letting the body heal itself. So there's a lot that goes into this. It's not just putting somebody on a table and adjusting them. I'm trying to figure out what is the cause of what's going on. Taking the history, doing the exam, and really trying to find out for that individual person, what is causing their low back issue? Is it their vertebrae out of place? Is it that the muscles are tight? Is there a trigger point? Is it that they have loose ligaments and they don't have enough stability and not enough core to hold them together? Is it that they sit too much and don't exercise? Is it that they have a herniated disc, or maybe the disc bulge ruptured? Do they have sciatica? Is it true sciatica? There's so much that goes into figuring out exactly what a person's problem is so that I can best help them. It's not just simply everybody gets the same treatment when you come in with low back pain. And then, of course, I'm looking at curvatures in the way of, are there any scoliotic curvatures, which might be created from one leg being longer than the other. I'll talk a little bit more about that as we get into the lower extremities. And then there's also something called spinal stenosis. And this is where the vertebra canal, this is actually the spinal cord coming through here. I don't know if you can see that really well. This is the thing with the spine, right? So there's the spinal cord, that yellow thing in there. So the hole that fits through, if that gets too narrow, it can actually compress the cord. And this is one of the things I'm always looking at, because that is very, very dangerous. And we don't want to just gloss that over. So I'm also looking for contraindications to adjusting people, or maybe modifying my approach depending on what is going on with them. I'm going to quickly also mention sciatica, because so many people will come, well, I've got sciatica. Well, what is that? That means that the sciatic nerve, it's a little bit hard to see here, but it's the nerve coming off between the fifth lumbar vertebra. We have 5 lumbar vertebrae, and the sacrum. That's that triangle shaped bone at the end of the spine here. So the sciatic nerve comes off here and it travels down here. And this is where we have our glutes. And there's a little notch there that people will often feel it in when it becomes compressed. So This is why I do orthopedic testing, neurologic testing, to try and see exactly what we have going on with this low back pain. So in general, as far as chiropractic is concerned, a growing body of research supports chiropractic care for lower back pain. After an extensive study of all available care for low back problems, the Federal Agency for Healthcare Policy and Research, now it's called the Agency for Healthcare Research and Quality, recommends that low back pain sufferers choose the most conservative care first. And that includes chiropractic, because it is a drugless approach. It's a natural approach. It's very conservative and generally very safe, as long as we're ruling out more serious conditions. And it goes on to recommend that chiropractic, or they use the term, it's generic, spinal manipulation, as the only safe and effective drugless form of initial professional treatment for acute low back problems in adults. And I just quoted that. So there are a lot of other research studies out there. There was one in Spine looking at chiropractic as just as effective as a combination of medical care and exercise, and evidence that it is as effective as a prescription non-steroidal anti-inflammatory drug combined with exercise. So there's a lot of things out there basically proving chiropractic is safe and effective for lower back issues. So you're in the right place. All right. So basically, I'm also looking at your diet. What are you eating? Are you eating anything inflammatory, sugar, a lot of meat that might be very acidic, anything that you might be sensitive to? Are you getting hydrated to keep those discs nice and plump and the muscles hydrated so that they don't get tensed up? What is your exercise program like? Are you sedentary, or are you moving on a regular basis? Because that is one of the risks. Lack of exercise and too much sitting and too much laying around actually is not good for your core. It's not good for your back. All right. So there are different ways to adjust the lumbar spine. That's the low back. And a lot of people associate chiropractic with the traditional lay on your side and do a high velocity thrust. And that is very effective if that's what we deem is going to work for you. There's also things called sacral-occipital technique, which is a no-force technique. There are special tables that can be used that have drops that sort of take out that muscle tightness. So if you've got too much tension going on there, it is a painless way of getting adjusted. And then if you've got compression of these vertebrae in the back, so if these become compressed, and this is what happens with me, is that these kind of jam up here. Or if you have a herniated disc, that's that little red thing there, there's something called a flexion distraction table, which helps to get motion in the joints. It helps to get some hydration and maybe even help to suck that little protrusion of a disc out. And it can be super helpful in low back issues. So there's that. Totally non-force is even cranial sacral therapy. This is a little bit more of an osteopathic technique. All right, let's dive a bit into exercises. So there's that traditional spinal stretch where you lay on your back and you roll your knees to one side and the other, which is great. That's working on that rotation action of the back. I talked about stretching your hip flexors or the psoas muscles. And then there's the plow where you lay on your back and you bring your feet over your head, and that's a very deep stretch for the muscles in your back. And then side bend. So you're kind of trying to get to all those ranges of motion in your back and stretching those muscles out. And I really encourage you to subscribe to my channel, because I will be adding these exercises little by little to my channel so that you'll have videos of all of these. As far as strength, you cannot beat the plank. I wish there was something else, but the plank is the ultimate for your core. And as I said, I'm going to be talking more about the core, and I'm going to talk specifically how to do the core exercises properly, because most people are not. They're not using their core. They're using too much of their upper body. So plank, side plank, and bridge, where you lay on your back and you lift your hips up. You have to use a lot of your back core, your glutes to hold your hips up. And that can be accentuated or accentuized, that's not a word, accentuated with a ball, a stability ball to make things harder for the planks, for the bridges. And again, I will go into those variations. The other one that's really great that anybody can do is to get on your hands and knees. You can pad your knees if it's not comfortable. And it's where you raise your right arm and your left leg behind you, and you just stretch and pull them apart. So it's called the quadruped exercise. And you really pull your belly in. It's supporting that lower spine, and you lengthen and pull apart. And this is kind of segueing into my next one about inversion. Yes, I mean going upside down. It is so good for your spine. And for those of you who are old enough, it was kind of like a fad in the 80s, I think, where there were gravity boots. So you'd have this bar in the doorway, and then you would put these special boots on that had a hook on them. And then you'd somehow have to get your feet up and hook it into the bar, and then you hang. So now they have better devices that are easier to get into called inversion tables. And so you will strap your feet into a device, but you're upright, so it's easy to get your feet in. And then based on sort of a teeter-totter principle, you will slowly invert. You want to at least be a 30-degree angle. Some tables will go completely upside down and lock in, and then you can even do some core exercises that way. Or there's some other ones that actually you're hanging more from your hips if you have feet issues or it's just not comfortable. So there's a lot of devices, and a little Dr. Chris tip here, look on Craigslist or get it used. People buy the stuff, they don't use it, it's already assembled, there's not a lot of working parts to it as far as things to break down. So it is a really great thing to get used secondhand, because I spent hours putting my inversion table together, and yeah, I didn't need to. I could have looked on Craigslist, so I thought of it after. So again, you guys benefit, right? Or if you are so inclined, one thing that really helped me heal my back was aerial arts, circus arts. So trapeze, silks, and hammock are the three modalities that I do. And it's sort of like cross-training between aerial apparatuses, because I use a lot of my back core when I'm doing trapeze as I'm trying to balance on the bar on my belly and hold my body up. That takes a lot of back core. And also when I'm hanging on the bar for my knees or for my ankles, I'm getting that inversion and that lengthening, and then having to use my core to get up. So it uses so many of the things. And this is when it was sort of that crucial missing part for me. I was getting adjusted, I was getting massage, I was stretching, I was doing yoga, I was doing all the right things, except I wasn't using my back core enough and adding that inversion aspect to take the pressure off of my discs and ligaments and nerves. And then when you're in that inverted position, having to use your core to kind of get up out of it. So that has made a huge, huge, huge difference for me. All right. The other thing you can do is lose weight. If you have a lot of weight on you, that's a lot of stress on your body. You can also use things like heat or ice. And I tend to go and say to people what feels better, because sometimes, most of the time I want heat, but sometimes ice feels better. So you can also alternate between the two, but don't keep anything on longer than 20 minutes. All right, so just two little notes here, kind of just comparing chiropractic, which is really pretty super safe. We have the whole opioid crisis. So the American College of Physicians, the largest medical specialty society in the world, updated its low back treatment guidelines in 2017 to support a conservative approach to care. Again, this is including chiropractic. It is drugless. And then as far as surgery goes, so an article in the Journal of the American Medical Association suggested chiropractic care is an option for people suffering from low back pain and noted that surgery is usually not needed and should only be tried if other therapies fail. In other words, surgery last, because unfortunately, failed low back surgery is very common. And researchers believe that failed back surgery occurs anywhere between 10 to 40% of lumbar laminectomies. That's where they cut into the bone to kind of create more room for discs. And other studies show that 5 to 36% of people who undergo a discectomy, that's where they take the disc out completely, saw their leg and back pain return just 2 years after surgery. So unfortunately, repeat spinal surgery is a treatment option with diminishing returns. Although more than 50% of primary spinal surgeries are successful, which is still not a lot, guys, no more than 30%, 15%, and 5% of the patients experience a successful outcome after the second, third, and fourth surgeries. In other words, the more surgeries you have done, the less successful they are. And really, once you get one surgery, it changes how the low back is moving. It usually actually is one of the reasons people need to have more surgeries, because when the back doesn't move properly, it starts to degenerate. And I go into that degeneration a bit more in how we can help support the cervical spine in the neck. So I'll link that too. All right, here's my caveat. Symptoms that require urgent care. So if you are trying to do things on your own, which I don't recommend, if you have pain, it's your body's way of saying, hey, something is going on and I need help with this. And that's when you go to someone like me, like a chiropractor, so they can help you figure out why, so you can get to the cause of it. In general, this stuff will just keep occurring if you don't change things, right? And also, if it is a child saying that they have spinal pain, take that seriously, because children generally do not complain of spinal pain. So you definitely want to get that checked out as soon as possible. All right. So if you have severe back pain after a fall or injury, definitely get checked out by a healthcare professional. If you have warning signs like loss of bowel or bladder control, numbness, really anywhere in your lower extremities, but especially in the groin area, leg weakness, fever, any pain when you're coughing and urinating or bearing down to have a bowel movement, don't walk, run, and get that checked out. These can be signs of serious, serious issues with your spine. So you do not want to just brush those off. All right, everybody, that's about it for me. If there's no questions, if you liked what I have to say, please give me a thumbs up. Please share this with your friends and family. We know that most people are going to have some sort of low back issue in their life, so let them know what they can do about it. Please subscribe to my channel, then you will know when I do post these exercises, as I will be doing this on a regular basis, probably for a while. And I will see you next week when I will talk about shoulders and how to keep them working optimally so you can enjoy optimal health and an optimal life. All right, good night.